Alrighty, so we got some questions that were submitted through the app that I'm going to run us through. I'm sorry. Hi. The first question is, what are ways you've been able to channel your neurodiversity such that it becomes a positive differentiator rather than a social challenge? And this is not to anyone in particular, so if you feel moved to speak, go right ahead. You guys talking about it?
Can you repeat the question?
Yeah. Sure, yeah.
Thank you.
What are ways you've been able to channel your neurodiversity such that it becomes a positive differentiator versus a social challenge?
So that sounds like a lived experience question. If any of you has lived experience on that, I can comment with patients, friends, children. When, excuse me, when neurodiversity is seen as a power, when it's seen as something that's a gift, when you embrace the fact that, like, I have ADHD, okay? Can y'all tell? It's awesome. You can't hurt me with it anymore because I know it. Now that I know it, I embrace it. It's not something somebody can weaponize against me. And I feel like neurodiversity is the same, where once you embrace that superpower, once you embrace what makes you special, what makes you unique, nobody can ever use that against you anymore. It's yours, and it's yours to share it or keep it to yourself.
I think I don't know if you can hear me, I think I can comment on that a little bit. I now better understand, even after my time serving in a very public capacity, I didn't know at that point that I was really neurodivergent. And now that I look back, I better understand that actually allowed me to connect with people in a different way. I feel like one of the superpowers of having neurodivergence is a level of empathy and being able to connect with other people really at an emotional, deep level, especially other people that are neurodivergent. And I was able to really empathize with individuals that I had never met before in a way that I felt maybe wasn't natural for other individuals. And that really gave me an ability to form connections much easier in a way. It's very interesting because I get really overstimulated in large environments, but in the same way, I'm able to focus with one person in that environment, and that's where I thrive, rather than sometimes in large groups. Not that this is not, conducive to what I like to do, but sometimes it's harder to make those connections. And so I think that now looking back, I think that maybe that was part of what allowed me to be successful in some of those environments.
Another way to ask the question to providers is ways they've seen their patients channel that neurodiversity in a way that they admire.
I can speak to that. I think it's finding what you're good at, finding where you thrive and what it is that you have to contribute, and really leaning into that instead of putting yourself in spaces where the opposite is required of you. So I'm a super big picture thinker. I have a little dyslexia, and somehow those two things seem very connected to me. So I'm good at big picture thinking. I'm horrible at, hashing out little details. If you give me something to proofread, I'm gonna miss it. I'm not the right choice for that activity, but I'm a great choice for a different activity. So really putting yourself out there and availing yourself for the things you're good at, and being able to say, like, I'm not a great choice for that. I say that all the time at work. Yeah.
Since you mentioned dyslexia, I wanted to go to that question next. What are dyspraxia and dyslexia, and is it different than or a part of autism spectrum disorder? Can anyone speak to that?
So dyslexia is a reading disorder, dyspraxia, but that is not necessarily a part of autism spectrum. Autism spectrum, like I was saying before, it's social communication and restrictive repetitive behaviors. But the reading disorder, that's a different, you often see it co-occurring with ADHD and other disabilities or challenges, but it's not part of how you diagnose autism.
Okay, and then on a related note to the co-occurring question is, someone said, I've been diagnosed with an auditory and sensory processing disorder. Are these common in EDS? For the clinicians here, do you see that regularly? I know we don't have the research in front of us, unfortunately.
Well, I will say this. I will say, yes, it's common in EDS because autism is common with EDS. And a lot of times when parents come or people come, they're like, well, my child was diagnosed with a sensory disorder. And I'm like, okay, so the speech pathologist can tell you that, but they don't diagnose autism, so that's all they can give you. But basically, whenever someone's got like a true sensory processing disorder, they're usually on the spectrum.
Okay, one more question in this space. What are signs of neurodiversity that can often be overlooked or dismissed and lead to a lack of diagnosis?
Okay.
I think a lot of these are going to you.
Okay, so women and girls are very, very underdiagnosed because they're masking often from a very early age. Studies show that women and girls mask from like age 2. Girls also watch how other people act and they learn how to hold their hip or hold their purse or what to say. And so if they mask successfully, they won't get diagnosed. But also anxiety gets in the way, and that's something that overlaps with people with EDS, right? A lot. And so if you're a very anxious kid, whether you be male or female, and you're not causing a lot of disruptive behaviors that get you in front of a provider quickly, a lot of times it goes undiagnosed and goes missed. So those are a couple of, there's many, many examples though.
So I think this might be a good question for our physical therapists here. Any tips for handling medical anxiety after a lot of medical abuse? It really flares up leading up and into appointments with doctors or any healthcare professionals, so I don't perform well and I end up with more appointments because not everything was addressed. It's a waste of time and money that increases stress. Thanks for any tips.
Yeah, absolutely. I can speak to that. There's a lot of anxiety that can go alongside seeing a lot of doctors, especially when you've had so many negative experiences that surround these things. And so I think being proud of yourself for advocating for yourself to keep going to the right doctor or to keep looking until you find the right doctor, being comfortable with knowing if something wasn't the right fit to move on and find another fit that might be better for you. But also the mentality of looking at each day as day one, as a part of one day that you'll manage these things, is something I found really helpful. That way you can kind of help separate your past appointments from the appointment that you're in now, and you get that fresh, clean slate to start over with this doctor and give them a real chance as they give you one, if they do, hopefully. So I would definitely advise kind of clearing the slate and getting fresh when you go to a new doctor.
Yeah, I certainly agree with that. It's, every new person you go to, I've treated so many patients that just come in and I can look at them in 2 seconds, like they are not expecting anything wonderful out of me. Like they're expecting this to be terrible. And I spend like the first whole part of my exam, my goal is to just get that person to kind of relax and feel a little bit more comfortable and have a little bit more hope for the appointment. And so I think, coming in and giving some space for healthcare providers to do well by you, because, I've been a physical therapist for 27 years, so I have a lot of practice doing that, but that can be uncomfortable for providers, like, oh, this person is mad at me already, I haven't even done anything, And so I think your provider should be able to manage that well, but realistically, there's a lot of providers who don't manage that well. So I think really good point. I also think a lot of times you can't necessarily shop around for providers because you're capitated to one person, you have insurance, you have proximity issues. There's all kinds of reasons why you can't just find the perfect person for you. So the other piece of advice for me is like, get what you can out of whoever's in front of you. They may not be able to, they may not really be doing a good job at, seeing you holistically and giving you like a real holistic concept of what you need, but that doesn't mean that they don't have little tidbits that might be useful for you or little pieces of advice that might be useful, and doing your best to sort of get what you can out of that situation. And I'll say one more thing just about that anxiety and fear and like feeling like you don't perform well. I hate to think about you feeling like you have to perform in a medical appointment. I mean, you are seeking help. You should feel no pressure to perform. That doesn't mean you don't feel pressure, but really trying to sort of sort through that within yourself and figure out, what information do I need to convey to this person? If it helps to write it down beforehand, like these are the things that I want to get done. These are the things that I want an answer to, write that down. You can try emailing it ahead of time. It doesn't mean necessarily that it'll be read ahead of time, but do what you can. You have every right to advocate for yourself, and you have every right to ask for what you want in an appointment.
Can I add to this? I just want to add, this is hard. If you've had medical trauma, which is probably most people, if not all of us in this room, myself included, it is hard to go to a doctor's appointment after that. It is sometimes even hard to make a phone call to the receptionist at the doctor's office to make an appointment, because you've also encountered stressors there. So I think one thing I recommend is knowing that it is hard. Pace yourself. I sort of have a rule, if I can help it, certainly only one doctor's appointment a day. If I can help it, only one a week, to give myself to sort of rest before and after the experience. And also know that if you feel anxious in the appointment, that is to be expected if you have had and experienced medical trauma. I feel anxious as well in medical visits, and I do this for a living, okay? I talk to clients all day long about this, and I hear story after story of medical trauma and then going to appointments and feeling anxious. There's a reason you're anxious, and after the appointment, I encourage you to shake off that negative energy, whether it's like rocking out to like your favorite music or like going like this and just shaking out all that nervous energy. Knowing that you have a release afterward can also get you through. Like, oh, this is gonna be hard, but after I get out, I'm gonna go and do my thing and I'm gonna feel better. So those are some tips that I give clients and I extend to you all.
Well, and I'd love to speak to this from the other perspective as well and give advice to the providers that are in the room. And something that I make it a point every time that I see a patient that's struggling with a complex chronic illness, and most of the time that is something like EDS or HSD in my field, I am sure to say this is real, it's not in your head, you're not crazy like I was saying in the PowerPoint. And I ask the patient on the other side, how can we make this more comfortable for you? What can we do to make you feel more comfortable in opening up and telling your whole story? And I'm never opposed to letting my first visit be them talking the whole time, and I can hold how I can help them until the next visit, because I think letting them paint the whole picture and letting the patient really express everything they need to is the key to ultimately managing what they have going on, so that the whole picture, because there's so much more than just the one thing, and sometimes healthcare can be over specialized, and so allowing them to put it all in one place can be really helpful. So just a note to the provider that really in the first appointment, if they'll keep talking, sit back and take the back seat to your patient.
I appreciate you saying that we shouldn't have to perform in appointments, and I want to validate the reality that there are physicians and healthcare providers that we will encounter that we need to perform for, and that's one of those examples of a dialectic, right? We shouldn't have to, and we do. And so another just note about the interpersonal effectiveness skills within DBT and how much there's a specific skill in mind. You can even just look up the skill. It's called a Dear Man, and it's a skill for how to get what you want or what you need. And it's a great tool to have in your toolbox, and you can write it ahead of time. You can send it in an email, just a little tidbit. I also, Valerie, I was hoping you could share what you shared last night at the round table about having your medical history on the QR code. Do you mind sharing that? I think that's a helpful.
Oh, absolutely, yeah. So both from the patient and provider point of view, I'm a big fan of something that's called My ID, and they give you a QR code so you can scan that and it'll bring up your entire medical profile. So I was telling Francie last night about this. So the patient has the opportunity to really fill in detail in sections that you can well organize, and it kind of can help serve as a note for you if you want to print it out and bring it to your appointment so you don't forget to touch on certain topics. But also I actually have mine on a QR code on my bracelet too, so if I'm ever in a medical emergency, someone could just pull out their phone and get the information that they do need as well.
That's cool. All right, the next question is, my doctor keeps saying that stress and anxiety are making my symptoms worse and is pushing me to go for a psych evaluation. I've resisted this up to now because it makes me seem crazy. What do the panel members suggest I should consider as I think about taking the referral? Yeah, go.
Because I talk about this a lot. Okay. So, and this is actually a dialect, so it's, here's the thing. I mean, it's not in your head, and the fact that the provider is suggesting it, depending on the manner in which they do so, can often feel very harmful and often is very harmful, depending on what they mean when they say that. Even really well-intentioned providers don't get how incredibly sensitive we are to that suggestion, with good reason, right? Good reason to feel sensitive to it. I do think working with a psychologist, I mean, I'm biased, but can help, right? Like, I do think it can help because you can talk about these things, how to cope with living with a chronic illness. You may be experiencing depression and anxiety and other things on top of your chronic illness, and you may not, and still benefit, because we can also help with chronic pain, with insomnia, with other things that come up with living with a chronic illness. So what I would offer you is, the message might not be received well, or you might be concerned about who's suggesting it and why. And you can still follow through with the recommendation for your own reasons. Like, I'm gonna do this, but not because they suggested it, but because I think it might be helpful to me and part of my wellness plan. So that's what I would recommend.
And I can add to that a little bit. I think I've done a lot of work in collaboration with PT and mental health providers, and my specialty area is chronic pain in general. And I think that's a really nice team, and it covers, again, what you were talking about, those baseline things, right? Diet, nutrition, exercise, and kind of stress management and mental well-being, mental and physical well-being. So I think that yes, having medical issues is stressful. Yes, stress makes it worse. That's sort of what I was going over in those slides, is about just how much stress does impact you. Like, it impacts your ability to show up to places. So it impacts your social life. It impacts your ability to feel good, and it can impact your mental health. It impacts what's going on physiologically inside your body. It does have a really widespread impact. So whatever help you can get with that, and to manage that is great. And I think of, like, when you have a chronic illness, right? You're in charge of your own health. You are managing your own health. And healthcare providers should really be like your support team. And absolutely, a mental health provider of whatever type you choose is a great part of that support team.
Can I also add, I also do encourage you, though, to look for providers who have coping with chronic illness or chronic pain as a main part of their bio, and even better if they have EDS experience, because unfortunately, there are providers out there, mental health providers, who can cause medical trauma as well, who don't understand POTS, who don't understand, how POTS might look different from a panic attack. And I've heard stories from clients like, yeah, I was hesitant coming to see you because I've had this other experience where I sort of was told by my own psychologist that it's in my head. And hopefully this isn't the norm. I don't have numbers on this, but I would encourage you to, number one, try to find someone who has some chronic illness expertise, and then try them out as well. Take that 15-minute free phone consultation if they offer it. Try to feel them out. See the vibe you get when you speak with them. And if you do a few sessions and you don't feel great about it, then there are other providers out there. So research and look into sort of the person you're going to be meeting with.
I'd love to add on what Dr. Belvy was speaking to. I had a psychiatrist tell me that I was making up the diagnoses that she was using as the billing codes for why I was being treated. So that one was that threw me off a lot. So I think you're 100% right in saying that, understanding that you need someone to kind of be authentic and not cause more damage, I think is incredibly important. I would like to kind of speak to who asked this question and saying, maybe I think you're also very right on target of, like, it depends on how this question is being asked or being said to the individual who's asking this particular question. Because I've had a lot of providers who say, I'm not comfortable managing your mental health like a primary care, saying this is not my specialty, this is not my wheelhouse. I'd really like you to seek some type of mental health care outside of my practice because I don't have the expertise. And I think that I've had people tell me that, and it frustrates me, but in another way, I'm almost grateful that they admit where their limitations are. And so that, I think, is important to consider if someone's saying, hey, I don't feel comfortable doing this. Additionally, I do think that the psychiatric psychology component is really critical in the comprehensive care of Ehlers-Danlos syndrome and hypermobility spectrum disorders. And really at the very core, even if it's not, deciding to go see a psychiatrist or get a full psych evaluation, is that someone telling you that you might need to consider those type of issues in part of your holistic health profile? Are there things that you can do in your own life to be able to reduce your stressors, kind of like what you were speaking to in terms of how this can exacerbate some of our symptoms. I think that both of these things can be true. You're not crazy, but your symptoms very much could be worsened by your current mental kind of state. And I think that it's important to consider both. I've done a lot of work even through apps. You were talking about mindfulness. There's so many free resources that you can even find currently through books, through different kinds of meditation techniques that can help to alleviate those types of stressors and symptoms. But I think that at a certain point, seeking care in a way that is appropriate with individuals that are aligned with understanding how to treat individuals with chronic conditions, I think that all of those things can be part of a core plan. So maybe start thinking about, what can I do in my own life? How can I make this better? And do I need to seek additional care?
May I add something? You're correct. How that was suggested, like, hey, you seem a little crazy, go see psych. Yeah, that's not gonna go so well. But how you interpret it for yourself, a lot of people who have hypermobility, medications actually make you feel better. And it's not just about treating depression and anxiety. If it's going to tighten up your blood vessels so you have less vasodilation when you're stressed out, you might feel better all the time. You might react to stress better. So think about it as you're treating yourself physically, like it's a physiological thing. It's not a mental health thing necessarily. Your anxiety may just be your physicality. And so treating that, sometimes you need medication. Therapy does a lot. Physical therapy does tons. But sometimes you do need to add a little bit of medication or vitamins to help that.
We've talked about how there's so much chronic invalidation, and I think one of the ways to answer this question is to think about the function of therapy and the idea that therapy is supposed to provide what we call reparative experiences, where you bring your suffering to someone and they handle it well, right? You need to experience that to heal from the invalidation that you've experienced, and therapy can be a great place to achieve that. So can relationships, right? Social support groups, EDS support groups, family and friends who can be understanding and validating are also important. So I just wanted to mention the antidote to invalidation is validation, and you can definitely find that in the right therapist. Finally, we have a question on how do you think about the role of self-diagnosis for adult neurodivergent people? When might it be helpful, and are there times you might find it limiting?
So I think that so children who get diagnosed, one of the big advantages is they can get an IEP at school, they can get supports, they can get accommodations in school. Young adults going back to college, having a formal diagnosis can certainly help you get accommodations like for college. In the workplace, sometimes that can also be possible. That's a little bit of a double-edged sword, however. There are a lot of people who are adults, and self-diagnosis is just fine. Because if you just need to know for yourself, great, and that works. But if you're needing to know because you need help with disabilities, you need more supports, you need some supports in the workplace, or maybe your family doesn't believe you and you need their support, and so you need a formal diagnosis from a clinician that will validate it, then it's valid. But it's not necessarily, basically there are so few providers seeing adults, it's impossible for everybody who wants a diagnosis of autism as an adult to get that. And I feel very badly to say that, but that's the truth of the matter. So if self-diagnosing is helpful to you, that's the whole point of it, right? Is to know yourself and to give yourself that permission just to love yourself where you are. But there are times where adults definitely need to have a formal diagnosis.
Thank you all so much for being up here this morning. It was great being with you all. And thank you for everyone who's been here to listen.